One of the things I get asked about a lot is the resistance that staff show to change. And people, obviously in leadership roles, team leadership, doing improvement work, they want to know how can they get over the natural resistance that they feel from their teams, from staff, from leaders indeed, when it comes to changing things. And I like to remind people that in your own mind, a little kind of flag should go up, a little red flag. When you meet resistance, you should think, is this problem more complex than I thought? And I'm trying to put in a simple, obvious, to me, maybe very clear solution that is just a technical fix. And the rest of the team, the rest of the organisation, the people I'm working with, are seeing complexity and not seeing the problem the way I see it at all. Now, we certainly have to deal with complexity. We've got complexity of structure in Cumbria, so we've got the various trusts, North Cumbria, Morecambe Bay, the Partnership Trust, NWAS. We've got the County Council with its role both in adult social care and in commissioning public health. We've got the CCG as commissioners, the members as the practices. They're forming federations to think of themselves as providers. We've got complexity in strategy as well, with Better Care Together and the Vanguard bid in the south part of the patch, and Together for a Healthier Future and the Success Regime in the north part of the patch. And then overlaying all of Cumbria, we've got child and maternity services strategies, we've got mental health strategy. And if that were not enough, there is the natural complexity of the leadership role, the management role. So we have the culture and behaviour of colleagues and of all the staff. We've got desires within those complex plans for service change and service design to be tackled in a multi-organisational, multidisciplinary way. We've got the need for service user and public involvement. We've got to govern our organisations and show the regulators what we're doing and that we're satisfying various standards. We've got financial and contractual control, and we've got underlying strategies to do with IT and estates and workforce development and training and so on. Faced with all of that complexity, it turns out that most of the things we're trying to change, most of the things we're tackling in terms of improvement and the quality agenda are complex problems. And Ron Heifetz reminds us that when you're dealing in that complexity, usually the challenge is what he calls an adaptive challenge. It's not a simple technical fix. It's not something where the staff will automatically see it as being clear. And what does he tell us about these adaptive changes? How do we have to think about them? To overcome them, if you like, to be able to enable our change to happen, for the service design to flow, for the improvements to work, for the staff to be happy, for the patients to get a better experience. Well, faced with complexity, faced with an adaptive challenge, Ron Heifetz gives us a few clues. First, you actually have to think about the values you hold, the behaviours that we have, the way we believe the problem is constructed. Our role as leaders is to think about whether or not our beliefs and behaviours are aligned with the complexity of the solution. Secondly, he says, it's not us, the leaders, who are enabled to solve the problem. It's the people who have the problem who have to find the solution. So we have to let go and give away all of our technical strategies into that much more bottom-up process where the people who have the problems do the work of solving it. And of course it's going to take time because there isn't an on-the-shelf answer. It's not, well, this is broken, let's fix it. It becomes, this is different and challenging. Let's experiment and find a way forward, small steps at a time, using PDSA cycles, thinking about how we help the staff experiment with their own ideas about how to solve the problems. And finally, there's usually lots of change to meet that resistance in other people's organisations. So our change has to be across boundaries. We can't fix it within just our own team, within just our own span of control as managers. And that global exercise across organisations is the cooperation that we have to insist upon, expect, even deliver despite ourselves to enable the change to overcome the resistance. So my message is quite clear. When you are finding yourself slowed down in implementing a plan, when you're thinking a group of staff are resisting just because they don't like change or they're stubborn or even they're bad people, when you're finding yourself in that difficult position as a leader, remind yourself that because of the complexity, it's more than likely you're dealing with an adaptive problem. And if you're dealing with an adaptive problem, the usual levers you can pull in a technical way as a senior manager won't work, and you have to give the problem away, trust the staff to develop the answer with their own ideas, coach them through it, and most importantly, work in a collaborative way so that changes happen in more than one place across the boundaries of organisations, and we deal with the complexity. It's not easy. In fact, the final characteristic Ron Heifetz reminds us of adaptive problems is they're easy to deny. They're easy to think, no, I won't have to deal with it that way. My technical fix will do it. Resist that temptation, embrace the idea of adaptive change, and the complexity can be overcome in terms of meeting our needs to change things.